Good morning, preppers. What a gorgeous day to be outside in Michigan. Temperature's perfect, but yeah, winter's on its way. All right, so let's go through our next medical tub. As you know, we have a bunch of tubs. We have a surgery tub and an orthopedic tub, and the list goes on, a respiratory tub. And today we're gonna go through orthopedics. But of course, before we do that, let's do our quick disclaimer. Although I'm a physician, I'm no longer licensed. So therefore, if you want to verify this or make sure you do it the professional way, go to your regular physician and pay them a lot of extra money for the same information I'm about to give you now. Okay, so orthopedics. Orthopedics come down to this. Anytime you have anything going on with the bones or the joints, and there's a problem with that, maybe a break, maybe a dislocation, maybe you sprained your ankle, etc., that would fall under orthopedics. And orthopedics is both easy and difficult. It's easy to treat in most cases, but it's difficult to diagnose to see exactly what's going on because most of us, we don't have x-ray vision. I mean, I'll show you a trick though, so make sure you stay to the end because I'll show you a trick that might help you figure out if a bone's broken, which is of course a big thing. But you know what, even if that's not the case, understand some sprains are worse than breaks. Okay, keep that in mind. All right, so let's go through our orthopedic tub and see what we have. Now, when it comes to orthopedic stuff, I have some pretty advanced stuff in here. I have some pretty basic stuff too. For example, I have some triangular bandages. Oh my gosh, 30 years ago, almost 30 years ago, when I became an EMT, they told us about triangular bandages. And I was like, I thought that was like for like old school 50s Boy Scout thing, and not knocking Boy Scouts at all, but I didn't think we used them anymore, but that's not true at all. In fact, I'm kind of surprised in my orthopedic tub I have some of these things, but I have them everywhere. I always buy things in bulk and keep the extra ones in here. These things are great, by the way, if you don't have these in your first aid kit or your backpack, just to have these because they actually have all kinds of uses, including obviously like splinting your arm, for example, if you ever need to. Okay, when it comes to splinting, by the way, let's say you actually have a broken bone or a hurt joint, whatever the case may be. There's a real simple rule you can go by, and I'm gonna make more videos about this later, but here's a really cool simple rule. If you actually have a joint that's messed up, let's say your elbow, you don't splint the joint, you splint the bones above and below the joint. Like for example here, I have these giant splints, which you can just get on Amazon, and look at this. I mean, it's always best, by the way, to splint it in the position you found it, especially if there is medical care somewhere. Maybe you're hiking in the woods or wilderness, whatever the case may be, or there is a hospital and they have some medical coverage for you, even if crap hits the fan. But like if your arm's like this, oh, I think it's broken, you're not gonna take it and go, okay, now we're fixed. Not at all. So this splint in its form may not work for you. You can actually get some other splints, which I'll show you in a minute, or even aluminum splints, so you can bend the whole thing and conform to the elbow. But let's say your arm is straightened out and you think that the elbow's broken or dislocated, not dislocated, but like the actual joint is messed up. The rule is you want to splint the bones above and below. So you're not splinting the elbow itself. So if you put this on, you could tie it here and tie it here, leaving the elbow free. Or if a bone's messed up, maybe you suspect that one of these arm bones is broken, then you're actually going to splint above and below the joints. So you need to splint above the elbow and below the wrist. Okay, you got it? So we can put this here, splint right here, and off you go. Now, I'll say this, I can't say this enough. Anytime you ever splint, put an ACE wrap on, bandages, whatever the case may be, you have to check for signs of perfusion of blood. Because let's say I put this really nice splint on here, if I put it on too tight, it may cut off the blood supply going to the hand. So what you're gonna do is check the fingers. Now, a lot of people tell you to check the fingernails. You squeeze it, let go, and if it doesn't turn back to your normal red color within 3 seconds, well, you put the splint on too tight. I always say actually check the fingertips. It's just an easier way to look at it. It works the exact same way because a lot of times people actually have fingernail polish on and stuff. So if you simply just check the fingertips or the fingernail, squeeze it, it turns white for half a second, couple seconds, turns red, you're good to go. If it doesn't turn red, you put it on too tight. You need to take it off and redo it all over again. All right, so these splints, I'm going to put this and any other gear that we have in here, links below to Amazon. Now, I'm not trying to endorse Amazon. If you do click it and buy some, we get a little bit of the proceeds, which of course, as a family, we appreciate that. But it's not about Amazon. It's about clicking it and seeing exactly the kind of gear you should be getting. That's what it's about. So we have these big splints. These things are nice, but they don't fit in your box very well. All right, let's see. Now, we have what are called SAM splints. These things are the best. I was hoping I had one that's open. I don't see one that's open. So you know what we're gonna do? We're gonna open one. These things are amazing. Now, I always keep EMT shears in every box I have, because you'll never go wrong by having too many EMT shears. They're that vital. Okay, so these SAM splints, I mean, first off, you can't see this too well, but it actually tells you suggestions on how basically to do the splints. And these won't work by themselves. You're gonna have to have some kind of elastic wrap or ace wrap. But basically, you unfold these and they're moldable. So let's say that your arm is broken like this. This can be really difficult splinting yourself, but I guess if you're out in the woods, in the wilderness, you may not have a choice. Let's kind of make like it's called a gutter splint. Look how moldable this is. Is that cool? And so you're really gonna have to conform this to the patient again. So let's say he's like this, you're gonna take it and then bend this over. And now look, I mean, actually what really works really nice is you can take this end and do a little curl job. So that way their fingers curl over the top of it, very nice. And then bring it up, there we go. And obviously it's not perfect, but you keep working with it, and then you use ace wraps, that's the best thing to use, elastic bandages, to secure it to the person. So the SAM splint, these are absolutely gold, because it's nice to have these padded splints. It's very nice. The padding really makes a big deal, but for the size of these, and for the foldability of these, you can't go wrong. So SAM splints are amazing. Here's an official SAM splint, but these ones, now they just have knockoff ones. They call this an ever-ready universal splint. Yeah, universal splint. All right, and of course with that, in my box, I can't tell you how many elastic bandages. Look, here's actually 12 of them with the clips. Here's another monster bag of really big ones. Here's a couple of little ones just laying out on their own. Lots of elastic bandages. Okay, because you got to be able to use the splint. I mean, if you're out in the middle of nowhere, you can actually use a board, you know, something like that. If you actually use like some really heavy duty corrugated cardboard, you could use cardboard too. But the thing is, having something like this, which is cushiony compared to a board, try to put some kind of material on it, or a light pillow on it, or something like that, to make it more comfortable for the person. We're trying to give medical knowledge, right? I'm not trying to give you advice, medical knowledge in a situation where crap hits the fan. Because understand, in that situation, there may not be doctors, there may not be hospitals. So I'm gonna show you some other things that you might actually wanna have in there, but I can't stress enough how dangerous this is, because if you put this on, and let's say they actually have a displaced fracture, okay? This used to happen all the time, by the way, in the 1800s and before. Somebody would break their arm, they didn't have readiness to go to hospitals wherever they wanted to. So the family would just splint it up and let it sit like that for 8 weeks, take off the splint. Will the bone heal? Yeah, most cases it will, even if it's displaced, and forever that bone is going to be healed, out of place now. Okay, today's culture, we don't do that at all, obviously. In fact, you hear about doctors re-breaking bones, which has to happen sometimes simply just to put everything so everything's perfect, you know what I'm saying? Because in modern medicine, we try to make it so you were like perfectly back to normal, whereas crap hits the fan medicine, we want to make it so it's manageable, okay? So you can buy these on Amazon, which shocks me, but here they are. You can actually get casting tape. Yeah, casting, actual making cast. I've got a few of them, a few purple ones. Why? Because purple's awesome. But these are actually really, really easy to use. Make sure you put gloves on, because you're gonna get this casting stuff all over you. Dunk it in water, and then you're going to, okay, before you take that step, again, guys, I can't stress this enough. This is not to happen in regular medicine. You need to go to the hospital, you need to get an x-ray. But you actually have stockinettes. And I've got a couple stockinettes. This is a smaller one for fingers. Here's a bigger one, in case you need to put a cast on. So a stockinette is simply just a tubular gauze bandage. And so in that situation, you would put it on, cut the fingers out for holes, put some cotton on it, or if you're out in the middle of nowhere or don't have it, you can actually put like maybe an old shirt on there. Get the wrinkles out of it is actually the most important part. You're gonna take this, you're gonna dunk it in water and wrap it around and let it sit for a certain amount of time for it to harden. But guys, this video is not about really teaching you how to do these things. This video is about having this stuff in case crap hits the fan and there's no more hospitals. So the point being is, if you actually have what you think might be a break and you want to put a cast on the person, you're going to need 3 things. You're going to need the casting material, okay? You're going to need some stockinette. Could you get by without this? You probably could, you know, but the stockinette works very well in keeping everything separate from your arm. And then you're going to need some kind of cotton material or a shirt to surround it. But I can't stress this enough, guys. If you put this on someone and you don't know what kind of fracture you have there, you could deform them the rest of their life. Crap hits the fan, you may not have any choice. But there are certain things you can look for to see if they actually have a broken bone. And this is actually very good information. Listen to this. Obviously, an X-ray does very well for that, or a CAT scan. Most people don't have those in their backyard, okay? So what do? Well, look for deformities. Sometimes you can even feel the deformities in the bone. You can actually feel the bones are separated. Obviously, if the bone's sticking out of the skin, by the way, that is exceedingly bad, by the way. Exceedingly bad. We're talking about in a shit hits the fan scenario, could be fatal. Because what happens is you're like, oh, no problem, I'll take care of it. And you pull the arm and pull the bone back in and bandage it up. Yeah, you're good. You're not good. Because what happens is once it's exposed to the air, once it's exposed to your skin, once it's exposed to the outside world, that bone pretty much guaranteed is going to be infected now. And we're talking about an infection that'll spread down the bones and eat the bones away and actually go into their bloodstream and more than likely kill them. Okay, we call them open fractures. We used to call them compound fractures. Okay, but basically the open or compound fractures, once that happens, man, if you're in a shit hits the fan scenario and you don't have anything else going on, you're going to have to do something about scrubbing that bone. So in here, not that this is actually perfect for this. Oh, I don't have any in here. You can actually get surgeon scrubs, but if you actually do something that's absolutely going to kill the bacteria, like rubbing alcohol, they're going to scream. Get the guy drunk first. It might be your best bet. But you know what? It may be better with a closed fracture, but you're still going to be dealing with all kinds of problems. Because if you have a deformity where the bone's broken and you splint it like that, it's going to heal like that, and they're going to be having troubles with that the rest of their life, especially if there's not going to be hospitals in the future anytime soon. So you're going to have to try to do your best. You know, in the ER, we actually had the live x-rays, you know, just go ahead and put it in layman's terms, where we could actually set a bone in live screen and watch the bones doing it. Again, we don't have that kind of stuff out in the middle of nowhere. So trying to set a bone, I don't even want to even go there as far as doing that. I will tell you this, if this helps, which actually may not help a whole lot, because again, we're only talking about shit hits the fan scenario. Your muscles all along your arms and all along your legs and stuff, if this bone breaks completely, it's a complete break, the bones may do this kind of thing, or they may do this. And if you're trying to set it, you're going to try to make it line up again. It's really difficult. The best way to do it is through traction, where literally you pull the bones apart like this, especially if it's like dislocated. You're going to actually have to have one person here. I don't have a material, but you basically put a giant blanket right around here, and one person holds one end, while the other person grabs the arm or the leg and pull it. And often, once you pull it enough, it'll align back up again. Try to feel it and see if it's working, and then you're going to splint it. But I'm going to tell you right now, when we do this, when we did this in the ER, the patient would be on morphine. Morphine. I mean, the only thing you do is get them drunk out of their mind, but they're still, man, that's bad scenarios. I can't really stress how much that we're really going to be going by that disclaimer that I'm not giving you medical advice on this stuff, because I wouldn't want to deal with this stuff if it really happened being out in the wilderness. But there is one last thing I'm going to talk about. Well, actually, one more thing. When it cocomes to broken bones, obviously deformity for the bone sticking out. Another one's called crepitus, where let's say this bone's broken or you think it is. If the person moves their arm around, which is going to hurt, and you hear grinding noises, it's called crepitus. And that's a good sign the bone's broken too. All right, so what's another way we can check to see if somebody has a broken bone without an x-ray, without a CT, without a CAT scan? Well, in the olden days, they would use, ready for this? A tuning fork. And so I would suggest you get a set of 2 tuning forks for your medical kit. Because what happens is, let's say you think they have a skull fracture. I mean, there's not a whole lot you can do for a skull fracture anyway, but you plung it, boom, and you put it on there. It's not very comfortable on the head anyway, but they're like, oh yeah, that's kind of a weird sound, isn't it? You don't have to put it right on the injury, by the way, as long as it's on the bone connected to that injury or close to it. No, that doesn't hurt. Or let's say right here, you suspect that you broke your radius, plung it again, put it on there. No, it's weird feeling. Does it hurt? It may hurt a little bit, and it might hurt a little bit, but here's the thing. Your bones, by the way, don't have nerve endings, not for pain anyway. Very interesting. So when you break a bone, does it hurt? No, it doesn't hurt at all. what happens is there's actually a sheath covering your bone called the periosteum, and that's where the nerve endings are. So when the bone breaks, it rips that periosteum. And the periosteum is the nerve endings to tell you your bone's broken. And that would actually should explain things to you, because you ever seen a scenario where somebody broke a bone and they're like, wow, I didn't know it was even broken because it didn't hurt. That's because the bone broken away didn't tear the periosteum. Or somebody gets hurt so bad, they're like, oh my gosh, it's gotta be broken, it hurts so bad. And you go back, no, it's not broken. That's because it ripped the periosteum but didn't break the bone. So the periosteum, the covering around the bone, is what tells you if the it's what sends signals to your brain with pain. So if you take this and this bone's broken, plung it, well, not on their hand obviously, and put it on there, this tuning fork, or this one, you're gonna try both of them, put it on that bone, it's going to actually send vibratory signals to that periosteum, and they'll be like, oh my gosh, it hurts so bad. Every single time I've tried this, just for experimentation on patients, it has given a perfect positive sign and said the bone's broken. Now with that disclaimer, I mean, I assume that it doesn't really work as well as they're saying it does, or maybe it's only effective like 90% of the time, I don't know. But every single time I've tried it, which is multiple times, it's worked. So that's something you can do. So I'll put these in the description below. Get a setting tuning forks. It's something that could help you in identifying a fracture. All right, what else do we have in here? I mean, I have moleskin in here, which isn't really orthopedic, but if you don't know moleskin, moleskin's awesome. We talked about it before. Basically, if you're hiking, whatever the case may be, you can put this on, so it'll actually help you with blisters and stuff, or if your skin is rubbing. Okay, so with the orthopedics, guys, there's really not a whole lot else in here. Oh, there's one more thing in here. I definitely going to show you actually a couple more things. Here's some more of those splints, just like those orange ones. You can see there's actually a little bent up. They've been in here for quite a while, but they're actually just a little padded, almost cardboard with a little padding on there. They actually work well. And besides that, all I have is just more ace wraps, more casting material, and actually some tape too. Even though the tape's not the best thing you can for fractures or sprained ankles, etc. That's what you can do. Now, we like to, if it's not a broken bone, if you suspect it's not broken, then you actually want to splint somebody up. Again, disclaimer, there's only when shit hits the fan. Let's say it's their ankle. They twist their ankle and they're like, oh my gosh, it hurts so bad. I can move it though, but it hurts really bad. You're gonna want to splint it in what we call the neutral position. Your ankle should not be like this. It should not be down. It should not be down like this, your foot up. It should be the neutral position. Your elbow, neutral position. Your arms, neutral position. So if you are splinting, you can move it. Neutral position is your best. And if you're out in the middle of nowhere and shit hits the fan, I would splint it up and tell them you might want to keep it on for 8 weeks. It's gonna get stinky, but that's what's gonna happen. All right, the last thing I'll show you are, now again, I always buy everything in bulk, are some aluminum finger splints. These are amazing, because just like that, before I'll go ahead and bend this one, these are actually moldable and bendable, and you've probably seen some of these. Let's say my index finger is broken. I want to take it, measure it off. I'll go ahead and just bend it. Now, you don't want to have it bent to where it's going to compress the finger, but you can put the finger in there. Okay, so far so good. So bend this here a little bit. Looks good. Here's the hand. There we go. Oh, maybe a little bit more. And again, maybe at this point now you use some of the different tape, unless you have a really small ace wrap, but you can see that it's going to immobilize or hold that finger in place, so that way it'll be good to go. So again, I always buy everything in bulk anyway, but when it comes to finger splints and you're preparing for shit hits the fan, you might want to have these in bulk anyway, because these actually will be very beneficial. All right, that's everything in my orthopedic box, really. There's not anything else in here except, I mean, I actually do have like an old ankle brace, which I think actually I hurt an ankle like 30 years ago and I just threw it in here. You know, when it comes to stuff like that, I go to yard sales. Maybe it wouldn't be bad to find 1 or 2 boots in case somebody breaks their ankle, crutches, wheelchair, things like that. But again, with this type of stuff, I will actually have links for these in the description below, so you can actually check it out and see how much they cost. And of course, also in the description below, I have links so you can actually know what to get, medically speaking, as far as medical supplies. It's a medical supply checklist, which I forgot how much it is. I think I have it at $2, something like that. Just a little bit of money. But you know what? You set everything on here, so you may not want to buy that at all if you don't want to. It's up to you. But here's our orthopedic tub, and we have more tubs coming in the future. And if I actually single some of the stuff out to actually show you how to do it, I might do that too. But you know, of course, I have to be careful showing you how to do things for the fact that shit has not hit the fan, and I'm not a practicing doctor anymore. Okay, thanks so much for watching, and I hope you gleaned a lot from this. Hope you appreciate these videos. See you next time.